this point, patients are transitioning from perimenopause to menopause. We define menopause as 1 whole year without a period. And we can confirm that as well with hormones. And if there are no other concerns about differentials of what may be causing this problem, which could include thyroid or diabetes, then that by itself oftentimes will allow us just to give the patient the diagnosis of menopause. They, at this point, will complain more about the symptoms that are due to the lack of hormones as opposed to presence or abnormal relationship of hormones. These issues are typically more related to weight gain, decreased sex drive, vaginal dryness, skin and hair changes, fatigue. So these kind of symptoms are a lot different than what we talked about earlier with different age ranges, because these are the true symptoms of lack of hormones. These symptoms can persist for a couple years, but some of them can persist as long as you're alive for menopause. So some patients choose to treat these. Hormone replacement is one of the hot topics that come up with every one of these patients. Some patients are still open to using hormones. There were some studies a few years ago that scared a lot of patients away from using hormones. Interestingly, now there are new clinics out that will suggest that bioidentical hormones may be a little safer. All the data on that may not be out yet, and truthfully, if something treats the hormone symptoms and it behaves as a hormone, it probably still has the same risks. So we go over all that with the patients, whether they're a good candidate for hormone replacement, and if they're not, we do have a pretty good little toolbox of other choices that are medicines that can be taken either short-term or long-term to help with some of the same symptoms. Now, granted, some of those medicines, since they're not hormones, may not work as well, but the goal is just to get you to a point where you're happy with what you're dealing with. I have patients and they'll ask, am I in menopause? And the question is, they're going through a lot of hormone changes, and the hormones don't just suddenly turn off. There are fluctuations. And honestly, the fluctuations of those hormones are what cause most symptoms that patients call menopause. But the truth is, menopause is really when that is all done. So I'll tell patients many times that it's sort of like walking through a forest. When you get close, you can see the trees. You know it's coming. When you're in, you're just surrounded by all these symptoms. When you're done is when you pass out the other side. You don't have all the certain symptoms that you have during perimenopause. So we try to get the patients through the forest without running right into a tree.